Hey, everybody, welcome. This is Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. We are live right here on Friday night, right here in the Rock Health and Wellness Center studios in Lubbock, Texas. We're live on the radio at 98.7 Walk by Faith. We're live streaming at 987radio.com. We're on Facebook, X, and YouTube tonight as well. And shortly, we should be on the Facebook page at Walk by Faith, I think. So, hope you guys had a great week. It was a great week at the Rock Health and Wellness Centers. Um, Man, it's just almost always a great week at the Rock Health and Wellness Centers, to tell you the truth. Let me just make sure I got my sound. Yep. And we just had some really cool things happen this week. We're getting ready to have our Shockwave machine delivered. It will be delivered on, both of them will be delivered on Wednesday. So we should be good to go. And next week, start getting out after some soft tissue issues, your knees, your shoulders, your hips, muscles that aren't functioning quite properly. I'm kind of excited about this. I'm kind of excited about having this technology in the office. It's something that we haven't done a lot of over the years, to have kind of a pain management type of thing situation go on. But this is kind of a little different. This Shockwave stuff is a little bit different. So I think it's going to be really cool. I'm looking forward to seeing what we can do to help people regenerate some tissue. See if we can get some good tissue going in your knees, in your shoulders, and in your hips with that focused Shockwave machine. And then a bunch of stuff like plantar fasciitis. If you guys got pain in your feet, you got plantar fasciitis, and it just won't go away, and there's nothing that's helping you. This is FDA approved for plantar fasciitis treatment. It's FDA approved for calcified tendons in your shoulder, which is something we're going to talk about a little bit tonight. And so I'm really excited about that. That's coming next week. And Dr. Fraley's calling me, but I'm gonna have to hold off on that call. He forgets that I do this show, so I know he's not trying to call in on the show tonight, but I'll talk to him in a little while. But yeah, so I'm excited about that. I'm excited about. It was pretty cool to get to adjust the little baby this week. One of my patients came in and she says, "Is that baby getting adjusted?" And it wasn't the same baby. There was another little girl in there today. She's I don't know. She's 10 months old, I think, maybe 8 or 10 months old, and she was getting adjusted with her mom and dad, and so one of my ladies, she said, "Now that baby's not getting adjusted, are they?" And I said, "Yes, that baby's getting adjusted." And she was like, "What?" And I said, "Yeah, but that's not the youngest one we adjusted this week." She said, "You're adjusting babies now?" And I said, "I've been adjusting babies for 20 years. What are you talking about?" "Yes, I'm adjusting babies. We adjust. Why? Why do you adjust babies? Because they have nervous systems. Because your entire body runs off of your nervous system, right?" I know you guys know that. She was a little bit confused about what we do in our office, and hadn't seen her in a while. She's kind of, but anyway, maybe we helped her out a little bit. We showed her that it's we do adjust babies, and we adjust them because they have a nervous system, and we want that nervous system to function optimally throughout their entire life. And so that was cool. But the one, I adjusted the mom on Monday at 11:45, 12 o'clock, and she had the baby at 3:12. So that broke the record from the last one. And so you can get adjusted all the way through your pregnancy. You might not know that. You can get adjusted all the way through your pregnancy. She was having contractions in there. And I tell all the moms, look, we got a rule at the Rock Health and Wellness Center. We do not deliver babies here. So you got to understand that from the get-go. So that was something that was super cool. So we adjusted the mom on Monday, and then she brought the baby back in. Super cool. This is the fourth baby for this mom, so she's a pro at it. And she brought the baby back in, and we adjusted the baby about 11:30, I think, on Tuesday. So and then the little girl, we had another little girl today. She's 3 or 4 years old, and she brought her babies with her. So that's always really cool. So I adjusted a butterfly today. It was a little, looked like a baby, like might be in a little cocoon or something, like a little doll, and she had butterfly wings on her back, and she had little antennas coming out of her head. It was a cute little thing, and then the other little doll that we adjusted was that belonged to the mom when she was a little girl, and she's and now she's passed that little she's passed that baby down to her baby, and the leg is the leg is wrong. The right leg was twisted backwards, like it had come off at some point, and they stuck it back on somehow. And I started to fix it, and then I started getting nervous. I was like, "Man, you're gonna break that." How you gonna explain that to that 3-year-old or that 2-year-old, however old she is? How you gonna explain that to her when you twist that leg back around to the front and it just comes off? It's gonna be like, nope. I just started to move it, and then I thought I had all those thoughts go through my head all at the same time, and I was like, nope, I'm not going to do that. And so we adjust them with the activator. We take the little activator, and I'll click the little doll, click them around their neck, and then I'll click them on their hips and all that sort of thing. And then we always check their ears afterwards. And so it was pretty cute. So this little girl, she's been adjusted, this 3-year-old. I think she's 3, 2 or 3, and she's been adjusted since birth. And so she comes in here and she just jumps up on the table and she runs the show. She helps me adjust her mom and dad while they're getting adjusted. And it's a lot of fun. Kids are great. And it's really cool with those babies. It's super cool because when you take care of those moms all during their pregnancy, and then the baby gets born, and then the baby comes into the office, the baby knows where they are. It's so cool. Like that's what another that 8-month-old today. That's what their mom and dad said, is like they were saying, she's so calm when she comes in here. I was like, yeah, she was here. This particular one wasn't, but most of them that go through it, yeah, they've been here for 9 months. They developed in this office. They've listened to my voice for a long time. They're pretty comfortable with it. So. Adjusting babies is not like adjusting adults. You don't do it the same way. There's much less force. It's very soft. We do a lot of soft tissue work, and we check some reflexes and we do some things like that. So it's pretty cool. It's a cool deal. And adjusting to moms, families. It's family wellness is what it's all about, right? And it's nervous system wellness. That's what we're really doing here. And it was awesome. So I don't know how many, 3 or 4 little ones this week. And then my oldest one, I think I ever adjusted, was 101. So we got the whole gamut of it. Because if you work on the nervous system, then you can do things like that. So tonight, what I wanted to do is this is clinical work. What you guys are getting is what I'm doing in the clinic, right? Like I just told you about my week, adjusting people and the things that we're doing and the techniques and the machines and the things that we're excited about doing and the supplements that we do and all the things that we do here in the office is what we talk about and I share with you on this show. Well, I had a patient come in today and she's got a problem with her shoulder. And she said, I hurt my shoulder. I think I hurt my shoulder from carrying that bag over there. So she had a kind of a big purse bag looking thing. And it was, she said it gets heavy at times. And I think I hurt it carrying that. And she made a statement to me and she was like, I didn't know if that was something that you could deal with. And I don't see her too often, but she said, I didn't know. I don't know if this is something, you being a chiropractor, I don't know if this is something you can deal with. Maybe I should go to a muscle person or something. And I'm getting better as I'm getting older. I'm getting better. It's offensive. It's offensive, but I don't get offended as often, right? That's an offensive statement if you had any idea what you were saying. But I didn't get offended by it. I just had to breathe. I had to breathe for just a second. Because it's a challenge, man. You say something like that, you're like, I don't know if you can do anything with my shoulder. I was like, give me that shoulder, you know? I was like, are you kidding me? Like, come on, man. Like, what the heck are you talking about? So we, I was like, yes, I can do something with that shoulder. I didn't even say anything to her, but I was saying it in my head. I was just like, what is she talking about? And what she's talking about is this definition, this old definition, and this ridiculous definition that chiropractors are bone doctors. It's a ridiculous definition that chiropractors are bone doctors. Chiropractors are nervous system doctors. What is my job? My job is to detect and correct vertebral subluxation, right? Not even vertebral subluxation anymore. My job is to detect and correct subluxations, interference in your nervous system, being in a state less than light. You guys know what that means, but they don't. Most people don't. But so what are we working on? What are we working on? We're working on the nervous system. So why did we get called bone doctors somewhere along the way in chiropractic? Because the bones of the spine wrap around the nervous system. That's why people think we're bone doctors, because when we adjust someone, we crack your back, right? Oh yeah, I went to the chiropractor, got my back cracked. Yeah, I feel better. It's like, in all reality, it's ignorant as it can be. It really doesn't even make any sense at all. It's like why would you crack someone's back? What is the point of that? What is the point of adjusting someone? Like, why would it even matter to get your spine adjusted? Because of the result on the nervous system. That's why it matters. So when she said that, and she said, I don't know if I can do anything, or you can do anything with this, you being a chiropractor. And I was like, okay. So what I did is I adjusted her, and then I worked on her shoulder. And I worked on her shoulder to try to correct the abnormal biomechanics of the shoulder. And when I say biomechanics, what I'm talking about is life movement, the abnormal movement of the shoulder. I can't go through all this range of motion because I've got the table in the way. But the way that what is going on in the shoulder. And I just thought to myself, if she doesn't understand that we can help you with the shoulder, maybe it would be a great show just to talk about it and go through it and just say, look, like this is why do we help you with your shoulder. So I put together we've got a couple presentations. I just put together a little shoulder presentation just to kind of walk you through some of the things and just to kind of show you what's going on with your shoulder. What is a shoulder? What can we do about it? Is there, like, I just put together this little 5-slide show just to talk about it and share it with you so that you could have a better idea of what's happening in your shoulder. Okay? So let's start with bones, because that's kind of the way we learned it in chiropractic school. We had different classes of anatomy, and we had gross anatomy, we had systemic anatomy. So we learned all the bones in the body first, 206 bones, right? Then we went back and we learned all the muscles. And I don't know how many we learned in chiropractic school. We've learned 605 muscles. 605 muscles in the AMIT technique that I've learned I've known since 2015. And 605 muscles means that a lot of these muscles have divisions, and I'll show you. You can kind of see it on this picture right here. For you guys on the radio, we'll just talk you through it. But this is the infraspinatus muscle that's coming on the back side of the shoulder, and you can see the fibers that are along that infraspinatus muscle right there. And you can, there we go. See if that shows up at all. But you can see those fibers there. There's separate parts to that. So there's several divisions of the infraspinatus muscle. That's why we say there's 605 muscles, right? But let's start over here with the bones of the shoulder, and let's talk about what are the bones of the shoulder. When you're talking about what's happening in your shoulder, what are you actually talking about from a bone standpoint? And really, you're talking about 3 bones total. There's some ribs involved in this whole thing, but really you're talking about 3 bones. You're talking about your humerus, which is your arm bone, right? From your elbow up into your shoulder. That's your humerus. Okay, that humerus is going to come in there and it's going to articulate. It's going to fit into a little ball, like a little cup, a fossa they call it, right? It's going to fit right into a little groove that is really part of your shoulder blade. So your shoulder blade on the back, which we call the scapula, the shoulder blade is an interesting. It's really an interesting bone because it's not attached to your torso. Neither is your arm bone. Your arm bone is not attached to your chest. Your arm bone, your humerus, is attached to your scapula, your shoulder blade. And your shoulder blade is just sitting on your rib cage. And then the last bone is the clavicle, and that's your collarbone. And that collarbone comes all the way to your sternum, and it runs all the way across. It runs all the way across to what's called the AC joint, the acromioclavicular joint. So the clavicle makes a joint with the shoulder blade. And if you go to your collarbone and you bring your collarbone all the way to your sternum, which is right underneath your chin, it's that dip right there. If you touch that collarbone and you bring it all the way to the sternum right there, that point right there is the only point that your wing attaches to your torso in a joint. This is the only joint that your wing. If I was to take a scalpel, a knife, and I was to cut that ligament that's all wrapped around right there on that clavicle, if I was to cut that, then I could take and just peel your shoulder right off of your torso. There's nothing else attached there. Okay? So because of the way that this is built, the shoulder has all kinds of range of motion. There's just so much that the shoulder can do. It can just move, and you guys know that, it can move in so many different ranges of motion if your shoulders are functioning properly. And if they're not, we need to work on them better, right? And so when you have increased range of motion, you have decreased stability, okay? Your knee has a whole lot less range of motion than your shoulder. And your knee is way more stable than your shoulder. Because of it, your joint of your finger, all it does is flex and extend. It has a way, it's just simple little joint, doesn't have a lot of movement, it's very stable. But your shoulder's not really stable. And there's a bunch of things going on in that shoulder, and there's a bunch of muscles that are attached in there, and there are a bunch of nerves. And so I wanted this picture on the bottom. This picture on the bottom shows some of the nerve and blood supply that are coming off of your neck. And I can't blow that up any more than what it is. So maybe you can see it, but these yellow strings that are coming off of here, those are your nerves. And they come together and they make what's called your brachial plexus. It's not really important what it's called, but you've got nerve supply from your neck that's running to your shoulder. Okay? So when you break it down, it's like, okay, if my shoulder hurts, first of all, let's make sure we clear this up so that everyone really understands this. And we've said it lots of times, right? If you feel it, it's in your brain. If you feel it, it's in your brain. If you feel it, it's a nerve. There's a nerve involved. If you say my shoulder hurts, you have now brought the nervous system into that conversation, because you can't feel anything if you don't have a nerve. Okay, and you feel it in your brain. That's where you get that input. That input is coming into your brain through your nervous system, and that's why your shoulder hurts. It's your brain has a map. I had this conversation with Zay this week. Your brain has a map of your body, and when you send the signal from the shoulder into the brain processes the signal and it maps it to the shoulder in your brain. Your brain is where it has this, it's got this map. You've seen those like movies and they got the whole map of the earth right there. And it's like, all the countries or whatever. And then they're lighting them up or whatever. It's a map. Well, you got a map in your brain. And so what you do is, because it's a little bit hard to understand this. You never have shoulder pain. And you guys with shoulder pain are like, you're full of crap. Yeah. You don't have shoulder pain. You don't have low back pain. You don't have knee pain. What you have in your shoulder is you have receptors that are sending pieces of information into your brain. Your brain is taking that information, running it through lots of different systems in your brain, and then it's mapping out where in your body it's receiving this pieces of information, and then it's defining it as pain in your brain. So when a person says to me, as a chiropractor, can you help me with my shoulder pain? Because I'm not sure it's bone, I really think it's muscle. And it's like, okay, first of all, your shoulder pain brings the nervous system into the conversation. And then why are your muscles malfunctioning? And where are they putting pressure on your nerves? And what's going on there, right? And it's so you look at the nerves and you say, okay, these nerves are coming off of the neck. They're running down underneath or the clavicle. Some of them come over the top, but they're coming down through there. So now they're coming off your neck. They're running from your neck downward underneath that shoulder, collarbone right there. They're running deep into that trap, and then they're coming downward into that shoulder, and eventually they'll get all the way down into your hand. Okay? But they're coming around here, and they're just supplying that entire shoulder right there. So you're getting nerve supply, and that's why your shoulder hurts. It's because your nerve supply is getting interfered with in some form or fashion. This upper picture at the top is showing some of the nerves that are coming off, and that are kind of working their way down underneath that. So I just wanted you to see that there's nerves, there's bones, 3 major bones: your arm bone, your humerus, your shoulder blade, your scapula, and your collarbone, your clavicle. Those are the 3 major bones of your shoulder right there. Okay? So, which muscles move your shoulder? Where are those muscles attached? What are they doing to make that shoulder move through proper ranges of motion? How is the brain involved in that whole thing? Those are questions that we want to know, is like, what's happening to the shoulder. So when you look on the front, if you look at the picture, and on the front of the shoulder, you're going to see multiple muscles that are coming in here. You're going to see your pec major muscle that's attached to your sternum, and that muscle is going to run across your chest, and it's going to run up, and it's going to attach onto your humerus. And so, like, you do a push-up. When you do a push-up, you're working that pec muscle. pectoralis major and minor. You're working that muscle on that. So when you do a push-up, what are you actually doing physically? You're pulling your humerus toward your sternum. You're pulling your humerus toward your chest. You're pulling your arm toward your chest when you do a push-up. And you're flexing your pec muscle. Now, you've got other muscles involved, but anytime you're bringing that, you can just put your hand on your chest, just right up underneath your collarbone. Just put your hand on your chest and just move your arm across your body. As you bring the humerus across, you can feel that pec muscle flexing right there. And so the more push-ups you do, the bigger your pec muscles are. And so that's one of them. And there's the pec major and the pec minor. The pec minor kind of sits up underneath there, and then it comes off those ribs right there. But it's going to come all the way around. You're going to get, I'm going to show you some other ones. And then you get this big deltoid muscle that's over the top. And that deltoid's an interesting muscle because it wraps all the way around the shoulder. If you were to just put your hand right on the side of your shoulder, if you just put your hand right there on the side of your shoulder, you would be right on top of that deltoid. But that deltoid is going to come all the way around to this collarbone. And it's going to start like way over here in the front. Oh, sorry, I wasn't paying attention to the time. It's going to start almost under your ear. You can see it. It's going to come way around here in the front, and then it's going to wrap itself in the back. Let's take a break. We'll continue with the shoulder. We're going to break it all down before we're done. So we'll be right back right after these messages. This is Life with Jason Clemens, DC. I really am working to try to fix this and make the social media show match with the radio show a little bit better, because I know you all don't hear any of this stuff that's in my ear, and you just see me jump every once in a while. I'm trying to keep my eyes on the timer over here with the radio at the same time as I'm trying to look at the computer screen and talk to you on the camera, so it gets a little weird sometimes. But this deltoid muscle, let's get back to this. The deltoid muscle is on the outside of the shoulder, and it's going to come down and it's going to run to about, 3 or 4 inches down your humerus, and it's going to attach right on the outside of your arm. And if you run your hand down from your shoulder and you just stay on that bone right there and you feel that, you'll feel that tenderness right there. Like that is usually tender right there at that attachment point, where that right there is the attachment point of where that deltoid muscle is going to come down and attach to your humerus. And basically what your deltoid muscle does is it picks your arm up. So anytime you want to pick your arm up, that deltoid is wrapping around. So it's going to start way up here in the front. It's going to wrap all the way around. And then it's going to come on the back, and it's going to wrap all the way around the spine of your scapula. And so you can kind of see the picture right here this is the deltoid in the front. And then as we move to the back, there's the deltoid. It comes around and attaches to that spine. So it's like it's a pretty big muscle as far as surface area. And then it's on the top of your shoulder. And so that's its job, is to pick that humerus up. If you want to bring your elbow away from your torso, you're going to fire that deltoid. First thing you're going to do before that, though, and we'll get to that one in just a second, is you're going to fire the supraspinatus, which is above the shoulder. And I'll show you what I mean by that. Hang on. Okay, everybody, we're back. This is Life with Jason Clemens, DC. We're talking about the shoulder tonight. We just got finished talking about the deltoid muscle. We talked about the pec and the pec minor And we're going to get to the serratus in a second, but we're talking about the deltoid around the outside of it coming around to the back. And so we've got a picture of if you were to put your arm on top of your shoulder, and then where your fingers are, you can feel, if you just reached right up on top of your shoulder, like you were going to pat yourself on the back, and you put your fingers on the back side of your shoulder, you're going to feel a bone right there. And that bone is what they call the spine of the scapula. That's what you're feeling, is this bone that's running right across it sticks out of the scapula. It's kind of like a little ledge that sticks out the back of your shoulder blade. So there's a muscle that's on top of it, and anything that's on top is supra, right? Not infra. It's supra, and it's on top of the spinous, the spine of the scapula. So they call it the supraspinatus. And then there's the muscle that's under the scapula, and they call that the infraspinatus muscle. Those are two of the rotator cuff muscles rotator cuff, C-U-F-F, for everybody that's confused about that, okay? It's called the rotator cuff, not the rotator cup. It's the rotator cuff. And those are two of the muscles. And what that supraspinatus muscle does is it is the first about 10 to 15 degrees of raising your arm. So if your arm is down to your side and you want to pick your arm up, that first 10 to 15 degrees is going to be that supraspinatus. It's just going to start. It's not really a big enough muscle to really do much more than that, and it loses its leverage pretty fast. And so it just starts the motion. When you start to raise your arm away from your body, if your arm's hanging down by your thigh, and you just want to start that motion, that's your supraspinatus. Then the deltoid takes it the rest of the way. And so, but that's a really tender muscle a lot of times because of the way that the shoulder is rolling forward and the way that the shoulder is moving. So I just wanted you to see these pictures, and I wanted you to be able to see, like, okay, we got the supraspinatus, we got the infraspinatus, then we're going to get into the teres, which is the lower part down here. And then the last of the rotator cuff is the subscapularis, and it's on the underbelly. It's on the underside. It's on the front side of your shoulder blade. So it's kind of between your shoulder blade and your ribs, and they're all coming in here. And the way that they just kind of make a little cuff around that humerus with the way that they attach right there. And that's your rotator cuff, those four muscles right there. Then your lat, and that's the big wide muscle that you have on the back. You see the bodybuilders, when they do that little move, they turn on with their back to you, and they show you that lat. That lat is coming down here, and it's attached to your spine. It's coming all the way down there to your sacrum. It's coming over the top of your sacrum, way down here at the bottom, and then it's coming across your sacrum, and then it's going all the way up on the back. It's going all the way up and out, and it's attaching on your humerus. It's like that. What? That, okay, if the muscle attaches to the bone and the bone is part of the shoulder, then that muscle has something to do with the shoulder. Okay? So you gotta say, hey man, like there's like 40 muscles involved in this shoulder function. So you're going to come up underneath there with that lat, but it's going to go all the way to your sacrum. So a sacrum subluxation or a low back problem can alter the way that lat is functioning and cause you to have shoulder problems as well, and vice versa. If your shoulder's not functioning properly, you may be putting some stress on that lat, which might be pulling all the way down to your lumbar spine and across to the top of your pelvic bone. So you be having problems all the way from the bottom of your hip. I mean, the top of your hip can come right into the back of that as well. And like lat pulls, you ever heard anybody say that in the gym? Like where you get the rings or you do a ring lat pull, or you're in that lat pull machine where you're pulling your arms backward. You're working the lats, which is on the back side of the body. And what are you doing? You're pulling your arms backward. So that pull is what is bringing that, when that lat contracts and pulls the arm back and down right there, that humerus, then you're getting that lat involved there. And then you got this big diamond-shaped muscle called your trap. And it's coming off of the base of your skull. And it'll come down off the base of your skull. It'll come down to the tip of your shoulder. Like that trap comes all the way down. You can just, that's that one if you pinch somebody. If you're standing behind them and you got your hands on their shoulder and you just pinch their shoulders, that's what you're pinching. You're pinching that trap right there. And that trap's going to come all the way down. You can see it and go right there to that, come down to that spine of that scapula, run across that spine of that scapula, and then dive all the way down to like at your upper thoracic vertebra. It's going to come, your lower thoracic vertebra, all the way down into that T12 area. You're getting down in the bottom of that with that trap. And then it comes back and it attaches to every spinous all the way up, and then it comes all the way to the base of your skull. So abnormal posture is affecting the trap muscle. Like it's like when you sit and you're rolled forward instead of being set up straight. And so when you're not sitting up straight and you're not, you're slouching, you're rolling your shoulders forward, you're getting that trap muscle involved, which means you're getting all those spinous processes involved all the way through that, through your back. So there's your trap. It's like halfway down. I don't think it's all the way to T12. It's like halfway through there that it attaches to all those spinuses, okay? So, and it'll come up and it'll attach to the base of your skull. So forward head posture, everybody that's got that forward head posture issue, now you've got the trap involved again. So you can kind of, you see where what I say, a lot of times what I'll say on the show is that brain was first, then shoulder problem, right? I'll say brain was first, then low back problem. Brain was first, then knee problem. It wasn't the shoulder first, it was the brain first. And so if the brain's not firing properly, and we've got lack of, that's that whole, that's the old man thing, right? Like, let me show a different presentation just for a second, because I think this is a cool one. But let's get down to, let me see, that one, that picture right there. So what we've got for the radio people is we've got the picture of where the baby, you've got the baby looking up at the mom. It's got about 9 inches from the baby's face to the mom's face. That's about all a baby can see, and the eyes are down and in. And then the baby rolls over on their tummy, and the baby gets their eyes up. Look at where the eyes are. Look at where the eyes are in the picture. When the baby is laying on their tummy, their hands are out in front of them, their head is up. Their head is up, their eyes are up. That's neurology first. That's the beginning stages of brain firing. This going from laying on your back to rolling over on your tummy is in getting your eyes up, getting your head picked up. How do you pick your head up? You fire your extensor muscles. You fire your traps that I was just talking about. You fire those muscles that are on the posterior, on the back of your neck. That's how you get your head up. That's how this little baby gets its head up. And so flexion is taking your chin down to your chest. That's flexion. Extension is taking your chin up as high as you can get it. That's extension. So in order to, when we're born, we're born in flexion. We're born in flexion. Everything's flexed. We're all in this little, what do they call it? The fetal position, right? If you get in the fetal position, what's happening? Your hands are flexed. Your wrists are flexed. Your elbows are flexed. Your shoulders are flexed. Everything is in this little bundle, right? But we roll over about 3 months and we get our eyes up and we start to fire our extensors. So as our eyes go up inside of our head, our eyes go up, which there fires the neurology inside the head that turns off the flexors. You're getting it, aren't you? You're getting it. You're like, he's been saying that for a year and 7 months, and I just got it. Like, I get what he's saying now. It's like, wait a minute. My flexors are on the front of my chest. My flexors are on the front of my chest. I'm born in flexion. My shoulders are rolled over. How do I get out of that position? I turn on my extensors. How do I turn on my extensors? I roll over on my tummy and I get my eyes up. You see that's where your shoulder problems start. When that doesn't happen, that is the beginning stages of your shoulder problems, because your frontal lobes inhibit your flexor muscles. Your SCM is a flexor. That muscle on your neck is a flexor. Your pec is a flexor. Your bicep tendon is a flexor. So if your brain doesn't turn off your flexors get tight and your shoulder internally rotates. And now your pec muscle you're doing a push-up. Your pec muscle is contracted. When your pec muscle is contracted, your infraspinatus and your supraspinatus and your rhomboids and the muscles that are on the back of your shoulder are inhibited. They can't function like they're supposed to. You can't have a flexor muscle and an extensor muscle contracted at the same intensity at the same time and a joint move. Think about it. If I want to flex my finger or I want to extend my finger, the muscles that are on the front, which are actually in my forearm, but the muscles on the front of my palm have to contract, but the muscles that are on the back, which are also in my forearm, they have to relax. You can't, if you do both contraction and if you do flexion and extension contraction at the same time, that joint just doesn't move. It just stays very stiff. It won't move at all. The same thing with the shoulder. We're talking about the shoulder tonight, right? The shoulder. Yes, we're talking about this statement. Well, you're a chiropractor. Can you even help me with my shoulder? Isn't it muscle? I'm like, what the heck is the muscle doing? Why is the muscle not functioning properly? Let's start with the brain. Let's get the brain to fire. Then let's look at what's going on in the shoulder, right? This baby's going to crawl. This baby's going to walk. This baby's going to walk upright until this baby starts to lose its frontal lobe, and then that baby is going to start to go back into flexion. Then that person's going to have shoulder problems, low back problems, hip problems, knee problems, plantar fasciitis problems, all this stuff that's going on in that human being that's in flexion trying to function. That's when you tear your rotator cuff. You tear your rotator cuff, the rotator cuff muscles are mostly on the back of the shoulder, but the front muscles got the shoulder pulled, which means the back muscles are stretching. So now, and the shoulder is not in the proper position when you go to grab that bag. So now you go grab that heavy bag that you've got and you pick it up, but now we've got abnormal neurology going on in this shoulder, which is causing us to have abnormal muscle function in the shoulder, which is causing the front muscles to be tight and the back muscles to be inhibited, which make them weak. A tight muscle's weak and an inhibited muscle's weak. So this shoulder is weak. And now we're going to load the shoulder with the bag, and now we're going to hurt the shoulder. The muscle's going to give out, and then we might tear the tendon, right? Remember what AMIT was all about last week when we had this, all of a sudden we had this quick shut-off mechanism thing that was going on? And so there's a there's a lot, right? There's a lot going on in that shoulder. There's a lot of muscles that are on the backside. There's a lot of muscles running up to the neck. And there's also your bicep and your tricep get involved in a lot of this, and some other muscles in your arm. But you can kind of see that long head of your tricep, and I don't, it's sometimes I don't know if you guys can see the mouse or not, but the tricep comes up. One part of the tricep, because the tricep is now going to attach, it attaches at the bottom to the ulna, which is the one of the bones in your forearm. But where it comes up is going to attach on the humerus, but that long head is going to come on up there, and now you're going to get part of that shoulder blade involved in that tricep. So we've got that. That's a part of it too. And then you can see this infraspinatus and the supraspinatus, and then the shoulder blade itself. And then on the other side, you've got the lat coming in from all the way from all those spinuses coming up through there. And then you got that deltoid over the top. And you got all those muscles right there, right? What controls a muscle? A nerve. Where does the nerve come from? The brain, right? Okay. This is a common problem right here that happens. Let's go to the next one first for just a second. Okay. If you can see any of these pictures, I'll try to walk you through them either way. But the supraspinatus muscle. So if you put your hand right on top of your shoulder, and you feel that spine of your scapula back there, but you come forward just a little bit, you're right on top of that supraspinatus. And I want you to see from this picture that's on the left, I want you to see where that supraspinatus, so now we're looking downward from the top view of the shoulder. We're looking down on it, okay? This is the clavicle in the front. So your collarbone is in the front. And then that supraspinatus, what it's going to do is it's going to run under the top of this bone, the part of your shoulder blade. So your shoulder blade makes a little hook. And then your clavicle comes in and attaches to that little hook, and that's your AC joint right there. That's the separated shoulder in the quarterback room joint. But this acromion is this part of that spine of that scapula, and that's the whole scapula is going to come through there, and it's going to make a little hook. And the supraspinatus muscle is going to run underneath that, and it's going to attach on the humerus. So it's going to attach right on the front of the shoulder. Okay? So you're going to get this pain, right? It's like, Doc, it hurts like right there. Like, ow. Like it's right there. It's not right on the midline. It's a little bit forward from the midline, and it's right on the top of that arm bone. This is your humerus. It's right on top of that, and it hurts right there in my shoulder. That hurts. Okay. There's two main muscles that are responsible for the movement of your shoulder blade to get out of the way. You've got to have rotation of your shoulder blade when you raise your arm up. When you raise your arm up to 90 degrees, your humerus is going to hit the top of that shoulder blade hook, and it's going to pinch that supraspinatus tendon right there. So you've got to be able to rotate that shoulder blade out of the way. You've got to rotate the bottom point, because your shoulder blade comes down to a point. and it on the lower edge of it comes down to a point. You have to rotate that point out. When you rotate that point out, you move the top of the shoulder blade and you rotate the shoulder blade. And rotating the shoulder blade allows you to bring your arm all the way up without jamming your supraspinatus tendon. You got to be able to, when you do that and you bring your arm up, that shoulder blade's got to roll. So which muscles are responsible mainly for that shoulder blade rolling? Hang on, I've lost my radio station. I don't know what the heck happened. But we're going to go on with it. Give me a second. Happens sometimes when we get storms. I don't know. Shutting us down right here. Can't control it. I'm going to have to restart that. All right. The serratus anterior. This is that muscle that's called the serratus anterior. This is the lower division. This is the upper division. This is that fan muscle that you see on bodybuilders that comes right around the front. It looks like a fan right there, and that it's all right through there. Okay. The serratus comes from, it attaches to the rib cage, and then it runs underneath the rib cage to the back, and it attaches on the medial, the side of the shoulder blade that's closest to your spine, but it attaches underneath it. Then you get the upper trap. Oh, hang on. You get the upper trap involved as well. So the trap that's coming off of the base of your skull is going to come down, and it's going to attach to that spine of that scapula. And that upper trap and that serratus anterior is what's going to move that shoulder blade to keep you from jamming that humerus into that supraspinatus tendon right there. That is key. That I work on those two muscles all the time. And that's what I worked on with my lady today that had the shoulder problem. I did the same exact thing with her. I worked on that, and I did what we call origin and insertion technique. And but I work on those muscles like, I don't know if it's every single day, but it's multiple times a week right there. Nope, I'm out of it. Man, I'm out of it for some reason, but I'm going to finish it right here. When the origin and insertion of the muscle, that's why we talk a lot about the enthesis. We talked about it last Friday, and we talked about the enthesis, and the enthesis is the attachment point of the muscle to the bone. Remember, when you take the muscle beyond its capacity, all of a sudden the muscle will shut off. Well, if these get a little loose, if those attachment points get a little loose and they don't fire, they'll get that enthesis to kind of pull on there, and it'll shut that serratus muscle down, And what will happen is when you raise your arm, your shoulder blade won't rotate. And when it doesn't rotate, you jam that humerus right in top of that acromion, and it hurts. And then you get that supraspinatus tendonitis in the beginning, and then you get supraspinatus tendinopathy over a period of time. So those two muscles. So that's what I do is I'll try to reset those muscles, and then but the nerve supply to those muscles is coming right off your occiput, right off the base of your skull. Between your occiput and C1 is the nerve supply to the upper trap and to the serratus. It's a spinal accessory nerve, and it's coming off right there. So if your head is on crooked, if your occiput is subluxated, and your head's on crooked, you could be putting pressure on that spinal accessory nerve, which is now causing the upper trap and the serratus muscle to malfunction, which is causing the shoulder blade not to rotate when you raise your arm up, which is causing the humerus to smash the supraspinatus tendon and make it hurt. Now, and now your shoulder hurts. Can't do anything about that shoulder. Are you kidding me? So, yeah, that's a major factor. That right there is the OTZ, they call it, technique, and it's a major to fix it. You adjust the cervical, and you could get a frozen shoulder to unfreeze in like one adjustment. Sometimes, like it just takes very little time. Get that. That's got to function better. I usually do more work on it. I'll usually use the origin insertion part of it and try to make it a little bit better. But that's that one. And then I just wanted to show you this last one, just because this is the levator scapula, and it's attached to the top, right up there at the top of your shoulder blade on the inside, and it runs right up to your neck. And that's very tender a lot of times, and it's that part of your neck you just wish, it's like, oh, I just wish I could get that to move a little bit. That's what that levator scapula is coming right there. I just wanted to show you a picture of it so you kind of could see it. But that's also related to the scapula and the neck together. So the shoulder joint is, I mean, you shouldn't ever think of I don't think a person should ever think of it as, is it muscle or is it bone? That doesn't even make any sense. It's both if it's muscle, it's bone, because all the muscle's attached to a bone. If it's muscle and you're feeling it, it's a nerve. If it's muscle malfunction, it's nerve. The bone is irrelevant unless it's got some sort of cancer in it. The bone's irrelevant other than the fact that it's not moving through the proper ranges of motion. So starts in the brain, getting the brain to fire properly, getting the flexor muscles to turn off, the extensor muscles to turn on, getting all those origin insertions in those 40 muscles firing properly. If any of those muscles are aberrant and turned off, you got to get them to turn back on. That's what AMIT is about. If you need to work soft tissue in the muscle, then of course, like there's some myofascial relief stuff that you could do that's muscular that will help the nervous system. Of course, you can do that. But that whole thing together is a unit, and the way that your brain works has a lot to do with the way that your shoulder works. And yes, we can help your shoulders. We can help your hips and your knees and your ankles and your shoulders and your elbows and your wrists, this carpal tunnel stuff that people deal with. And one of my conversations today was one of my patients tried to get her boss to come see me, but her boss wouldn't come see me. And now her boss is going to have surgery on her back. And I was like, it's so funny because you can always have surgery. It's like having surgery should be the last option. And sometimes it is the option, don't get me wrong, but it should be the last option. We ought to try to do all the other things first to see if we can solve that problem before we go cut through that tissue. Because now we can't uncut it. It's cut for forever, and then we hope it heals and functions properly. And sometimes you need it. I'm not saying that's not the case. My mom needed her hip replaced. There's no question about that. And she's doing great, by the way. And she might be listening right now. Hi, Mom. I'll talk to you in a minute. But we can help you with all those joints. We can help you with your TMJ too. It's another one that people don't understand. Hey, that's all I got for you. Thanks for watching the show. I know that's a lot of information on the shoulder, and I hope it makes some sense, and I hope that you have a great weekend, and if we can help you out, please let me know. And otherwise, we'll see you Monday night at 6.